Good morning, guys. Welcome to the vlog. I'm a little more dressed up today because I'm going to dinner right after work. Like literally, they're picking me up from the hospital. Super excited. It's people I used to work with when I was a phlebotomist, and I haven't seen them in a while, so I'm super excited about that. I am here at clinic again. The attending I usually work with for primary care is out. She's taking a vacation days. Like yesterday was Veterans Day, and she's taking like Thursday, Friday off. So I'm assigned to a different primary care attending. I've never worked with this attending before. I do have friends who've worked with this attending, and they're like, she's not very particular, but she's a stickler for ICD codes. Not a problem. I feel like all attendings are. So you just Google ICD codes for whatever disease or illness you're treating that day. I don't remember actually what ICD stands for, but basically it's the billing code. If you come in for abdominal pain, there's some sort of code that I plug into the system that bills you for this problem. So this clinic I'm at uses a different EMR that I'm used to. It's called eClinicalWorks. I don't really like it, but it's not the end of the world. How many patients on the list today? We have 13 patients on the list. Arrived means they've arrived, and where it says room are the different residents that are seeing those patients, how long the patients have been here, their age, and their sex, of course. Pending, we don't know if this patient's going to come in. Confirmed means the nurses called them like the day before or maybe earlier this morning, and they've confirmed that they're coming in. ANSPH, I don't know what that means. Maybe like answer phone, like they called and left a voicemail or something. It looks like we're also going to have some phone visits today. Not a problem. Oh, my camera's not focusing. And this is only the morning schedule, 8:30 to 10:45. Look how close these people are assigned appointments. The scheduling system must be so hard to figure out because some people are always on time. For sure, they'll show up for their 10:30 appointment at 10:30 or even a little earlier. And some people are always late. And so that 10:30 appointment becomes a 10:45 appointment or something. And then some people don't show up at all. So like, if you could have 3 people scheduled for a 10:30 appointment and only one person shows up, you know? Where you get in trouble is where all 3 people show up for the 10:30 appointment at 10:30. Anyway, I'm rambling. There's 5 residents assigned to this attending, and there's 13 patients. I'm just gonna wait. Another patient just arrived, and someone picked them up right away. Like, I'll just be here. My strategy for getting done with clinic early is to see the patients as early as you can. So it's like you pick the first patient, and then other people have to wait for more patients to come in. By the time they're seeing their patients, you see, for the second set, you pick the first patient of the second set, and then you're done while they're all seeing their patients. Say everybody gets 2 patients, you're already done with your 2 patients, you're good to go. I, however, was late this morning. I took a lift here. It's raining in New York, so I didn't want to ride my moped. Plus, I have plans afterwards when we're splitting a lift. So what am I going to do with my moped, right? So I just took a lift to the office, and I was late, and other people have started seeing patients before me. So I'm going to be one of those late people today. Okay, someone just came in, and I snagged him, but then I see my name here with a pending patient. I would never write my name with an undercase G, so someone put my name here. Okay, first thing, I'm going to open the patient's chart. Start a progress note. I'm going to click on encounters. I don't think I can show you guys anything on this screen. But when I go to encounters, I check back to the last time they saw this particular doctor to see what was discussed. Last time they were here was 2 months ago. Issue is hyperkalemia. So they've had too much potassium in their blood serum. When they draw your blood and they do a complete metabolic panel, you see your electrolytes and their potassium is elevated. The reason that can be of some concern is because potassium is very critical in the way your heart beats, and too much potassium could lead to arrhythmias, also known as abnormal heart rate or heart rhythm. So you want to maintain a proper electrolyte balance in the body. Before I go through this note, I want to go through the labs the last complete metabolic panel, September, that's when they were here. It was elevated at 5.5. That's not a super high elevation, but it's something you need to keep an eye on. So they had repeat blood work in October, and the level was normal, 4.9. I'm gonna go back to the encounter now to see if they were given any medications. What we use in the hospital if someone has too much potassium is called Lokelma. It's a binding agent, and it helps your body excrete the potassium. I'm just gonna read through this note from the last visit. Under assessment and plan for hyperkalemia, they put to repeat the potassium, repeat the complete metabolic panel. Okay. So I went through the chart, the remainder of the chart, and the patients, this patient in particular is following up on a CAT scan that they did. Malignant neoplasm of colon. Okay, they followed up with an oncologist. Had a colonoscopy. They have to have a repeat colonoscopy and a CT scan. Let me take a look at that image. This is all what happens before we call patients into the office. We need to figure out what is happening before we call you in and we're just staring at your face. The time period when you're done with the patient but waiting for the attending is always super awkward. So I always have my iPad over here and I just walk around in the hallway. I either do Hopkins nodules, which are required assignments that we have for residency. We need to complete it within the first year. Or I do UWorld, or I take my phone, the phone I'm currently recording on, and edit part of the vlog. I'll do something just to be out of the room, because then we're just staring at each other. We've completed our visit, and we have to wait for the attending to finish with previous patients and to see this patient that I'm with, you know? See? The patients aren't the only ones waiting. We also have to wait to present to the attending, because while there's 5 residents, there's 1 attending, so they have to make the rounds with each resident to see each patient. Okay, just finished my phone appointment with the patient. It's basically just to review lab work. I think it's a much more efficient way to do it. I think it's a lot better. There's no putting yourself at risk, leaving your house and exposing yourself to whoever might have this virus. There's no need for the patient to come into the office. There's no need necessarily for a physical exam. If we're going over mammogram results, there's nothing I have to do unless the mammogram was because of a suspected mass or we're looking for something. If it's a regular screening mammogram for a woman, we go over the results, it's benign, follow up in a year. Imagine having to come to the office, wait, register, vital signs, sit and wait for you to be seen to just get those results, and then you go home. The phone visits are so much better. So this is what I was talking about before. It's 11:27. I've seen my 2 patients. My name's not even here anymore. My patients are gone, and I'm done. So there's no one else to pick up because the people who have arrived have already been assigned residents. So now I'm just chilling. That's it. I saw my 2 patients. The morning appointments are done. It turned out to just be 11 patients. There was a couple no-shows. There were 5 residents assigned, 11 patients. I saw 2 more patients to be seen at someone else's clinic because obviously there's numerous clinics happening in this office. Then we will go and help with that other clinic. Usually everybody finishes around the same time though, so early lunch. That's great. Thanks for watching, guys. See you next time.